gentleman right here in the middle row with glasses. He's had his hand up from the beginning.
I'd like to say that I'm in favor of the public option. But I want the same public option to be what the House members and the Senate. I have been in previous jobs uninsured. I've been an individual plan before, and there's been times I couldn't pay for coverage or pay for the COBRA stuff from our previous employer. So to me, the public option is something that needs to be on the table, but it needs to be something that every House member and every senator and everyone in government is on or has the option to be on, because if there is a problem, if y'all are in the same boat that we are, it'll get fixed a lot quicker. Let me wrap this up. I'm getting interrupted here. But I just would like to say it's important that we're all in the same boat in the public option, where we can have a private insurance, but it needs to be something that's affordable, that I can pay for, or that I can at least have if I'm on unemployment or public assistance, so that we have some way of having, not universal coverage, but at least affordable coverage for everyone.
The issue of the public plan option, and it's an option. That is, obviously, it's very important to some people in this room. You really want it. There are other people that think that's a terrible idea, right? Some of you think it's a terrible idea to have a public option. It's perceived as being government run. Let me tell you what I see the advantages and what I see the disadvantage of it. The advantages are, I think that if you had some kind of a public option out there that got the same amount of money as a private plan, it probably would lead to lower rates. The concern is, and I think it's not a completely unfounded concern of the private side of this, is government would have an inherent advantage, I think. I mean, that's my own view. Now, a lot of people don't agree with me on that. The advantage is this. Let's suppose years go by and more people start signing up for the public option. Mike Ross got some changes, by the way, that it could be offered by private insurance. Insurance agents could sell the public options and things like that. I don't know if that would be what it turns out, but they could be. And time goes by. I think CBO estimated at the end of 10 years they thought there'd be about 11 million people. If at some point it became clear that, wait a minute, that government-run public plan option is floundering. It can't handle it. It's not doing it with the same money. Do you think the Congress is going to let the plan die? I think that's the part of the downside. I think that they would have this potential inherent advantage. But anyway, I'm still trying to sort all that out. It is not, as you saw over the weekend, the administration apparently is still trying to sort it out also. With regard to members of Congress, I don't know why people think that we have some kind of special congressional health plan. There is no special congressional health plan. We're the same. We're treated as federal employees. You can go online to the Federal Employees Health Benefits Plan and see we have choices that we make. My staff have the same choices I do. It's not each congressional office doesn't make a choice. Each individual federal employee makes a decision. I've chosen Blue Cross Blue Shield just because my wife's here and I'm in D.C. and I thought it made sense to have something that I knew would be good in both places. But it's not a public plan. It's not a government-run plan. I have to deal with Blue Cross Blue Shield.
Nancy, there's a lady who's had her hand up about 3 rows in front of you on the right there. Yeah, she's had her hand up a long time.
Thank you. Thank you for being here and engaging with your constituents. We appreciate that. As a doctor, you're well aware of the Hippocratic Oath, first to do no harm. There's no doubt that there are aspects of our healthcare that need improving. But why upend the entire system instead of focusing on the real problems? Just like auto and home insurance, ought to be available over state lines, thus increasing the pool of the insurance. It should be portable. People with employer-based health care, if they have pre-existing conditions, they become become virtually the indentured servant because they cannot change jobs. That needs to be changed. There could be laws to stop ridiculous exclusions of pre-existing conditions that really have no factor on that. The escalating cost is certainly a problem, but I'll be honest. I have a hard time taking seriously HR 3200 or any other health care reform that deals with the cost that doesn't deal with tort reform. Billions of dollars. Doctors have to pay an inordinate amount of liability insurance. It causes them to practice defensive medicine so that they have with an eye to defending themselves in court. I don't know why some of these things are tackled first and then see where we are.
All right. I agree with a lot of the things that you mentioned there. For example, the pre-existing conditions. We kind of have to walk down the road. So we're in agreement. We need to do away with the person that comes in and gets dinged because they have a pre-existing condition. But how do we deal with a person who comes in once they have their diagnosis of breast cancer and they walk in and say, okay, I now need health insurance? Well, here's how you get at it. You have to have, people have, like car insurance, we have to be mandated to have the coverage. And so you say, okay, that makes sense. We're going to have the mandate to have the coverage because it's not fair to insurance companies. But then we get back to the issue we had back here, which is, okay, then how does that person pay for it? Well, then you need a way of having a subsidy to help people pay for it if you're going to mandate it. And so that's how you walk down the road to having an individual mandate, an employer mandate, exempt a lot of small businesses. With regard to tort reform, there's two issues there. Number one, I'm not sure that this administration, given everything that people are saying about how they're trying to take over the world and take over the states, you know, tort law has been state law for 200 years of our history. We have let the states set tort law. The second thing is, I haven't seen the study. I don't think the studies are out there that say it saved as much money as people would think. The other issue is there's a flip side to that too. There are people who are big advocates of this bill who think that all the preventing stuff in this bill is going to save billions of dollars. I don't agree with that either. I think that it's not going to be so simple as to find, you know, a magic solution, either in tort reform or prevention, that's going to save all the money. Like we're not going to have to do the hard work of figuring out how to save money at the same time improve the quality of care.
All right.
Let me say one more thing on that, Skip. May I say one more thing?
Okay.
I want to go back. A lot of what you say I do agree with. And I think there is a lot of agreement. One of our Republican doctors, Dr. Fleming, I read a quote of his several weeks ago in the New York Times, in which he said he's coming around thinking that we may need to have an individual mandate. I mean, so I think there's increasingly agreement, and several of the things that you mentioned I'm in agreement with.